Hey guys, Montel here, and welcome to this edition of Free Thinking. Our guest today is a clinical professor of medicine at the University of Iowa, an IFM trained physician, educator, researcher, and MS patient. She was dependent on a tilt-recline wheelchair for 4 years due to multiple sclerosis until she reclaimed her health using a diet and lifestyle program that she designed specifically to restore her cellular health. Now she pedals her bike to work every single day. Her training program, the Wahls Protocol, is an autoimmune protocol that has transformed the lives of thousands of people around the globe and has changed the direction of dietary and health behavioral research for neurological and autoimmune conditions, including MS. She's back with us today to share some exciting research results. Dr. Terry Wahls, great to have you back. Thank you so much for being on this edition of Free Thinking with Montel.
Great. Thanks for having me.
Absolutely. Tell us a little bit about the recent study that was done on the Wahls diet and what was the objective and how was the study set up?
Okay. So this was a study comparing the low-fat diet, the swank diet, and the Wahls diet, basically my level 2 diet. And what we did was first, I want to make clear that we had a conflict of interest management plan in place so that I had no contact with the study subjects. I had no contact with the data. And we had a statistician who did the analysis that was masked to study assignment. So this was as objective.
As double-blind as a double-blind could be.
Absolutely.
Right.
And so, our big objective was we wanted to see what was the effect of the swank diet and the Wahls diet on fatigue, on quality of life, and on walking endurance. And we know, because of the other studies that I've done, I knew that people in dietary studies really want to be doing the intervention. They don't want to be in the control arm. So we used a design that allowed us to observe everyone for 12 weeks, the observation phase. Then we randomized them to either get down the swank diet or down the Wahls diet. And then we trained them with our dietitians and we gave them weekly support calls for a month. And then we were available to answer any questions, provide any support as needed. They came back in at 12 weeks. We repeated all the assessments again. So this is the third time. And that's our intervention period. Then we brought them back again after 24 weeks of intervention for the final assessments. And we're looking again at measures of fatigue, the fatigue severity scale score, and the modified fatigue impact score. And then 2 measures of quality of life, the physical health composite and the mental health composite. And we had them walk 6 minutes. Now, what go ahead, Montel.
Go ahead. I'm sorry, I didn't cut you off.
Okay, so the most important question is, during the observation period, was everything stable? Did the fatigue levels change? Did the quality of life change? Did walking endurance change? And it did not. So that's stable. People were randomized. The 2 groups, the Wahls group and the swank group, were similar in terms of how disabled they were, how fatigued they were, what their quality of life was, how far they could walk. So the groups start out the same. And our primary outcome was change in fatigue severity scale score. And that is 9 questions that people were rating how fatigued they felt in various aspects of their life. And they were not different. Both swank and Wahls had clinically meaningful and statistically significant improvements, that is, reduction in fatigue at 12 weeks with fatigue severity scale score. And statistically not different. Now, the good news is that would tell us that improving your diet, doing either the Wahls or the swank, was very helpful at reducing fatigue. When we looked at quality of life measures, the physical health, mental health quality of life, the Wahls diet was remarkably improved at 12 weeks, and it was statistically more improved than the swank group.
Wow.
And the measure, the unit of change that's clinically significant, Montel, is if you get 5-point improvement, that's clinically meaningful. We had about 14 improvement at 12 weeks that continued to improve further at 24 weeks. Swank also began to improve their physical health and mental health. But again, Wahls was statistically and clinically greater than Swank at both 12 and 24 weeks for both physical health and mental health.
Well, these results are clinical research results that are confirmation of what, both you and I have already known about
Yeah.
ourselves, and that is that diet as well as exercise and lifestyle can have quite an impact on managing an autoimmune illness. Let me ask you a question. This is really kind of a very interesting one, but I took my COVID vaccine,
Mhm.
had that back in January, February, and literally I had a breakthrough infection about now 4 weeks ago.
Yeah.
So I came down with COVID. My symptoms were, now I've been saying this to people, though they weren't as severe as other people and people who I didn't have to hospitalize, I didn't even have to really go see the doctor. I did have a headache that was no joke. Um, I wouldn't
Yeah.
even describe it. It wasn't even like a migraine. It was like one of these, piercing things, like somebody was pushing a daggone ice pick through my brain for a little bit. But that didn't last long. Only lasted a couple of days, and I had some no, not really congestion. I had a sore throat that lasted for a couple of days, and then my symptoms kind of abated, except for the first time. I got to tell you, in the last 20 years of my life, I honestly have to say that for about 5, 6 days in a row, I felt fatigued. And I normally never have fatigue. Um, and I'm hearing so much about these people who are long haulers who have
Oh, yeah.
it. I'm wondering whether or not the Wahls diet, because I kind of live that diet anyway, but I
Oh,
wonder if
yeah.
the diet would have impact on people who are having that kind of a immune system,
Oh,
attack.
well, yeah. So let's talk about that.
Sure.
The long haulers certainly have a lot of excess activation of their innate immune system. So a lot of it inflammatory cytokines that are persisting. It looks very much like they have they're a prodrome of a autoimmune disease overt diagnosis.
Mhm.
When I see those folks in my practice, and what other functional medicine docs are doing is we're treating them like they are a autoimmune prodrome patient. So we put them basically on a diet that's going to look like the Wahls Protocol. I'll probably talk about vitamin D levels with them. I may talk about some antioxidant supplements as well. We'll talk about sleep. Probably encourage Epsom salts soaks, either and if they'll tolerate it, in a cool bath, so they can get some gentle hormesis, and let them know that gradually things will improve. But absolutely, you want to treat them like a autoimmune type of patient.
So, I mean, so people should really literally start considering the Wahls diet for this long haul syndrome,
Oh,
even though they have
absolutely.
not been diagnosed with an autoimmune disease. The symptoms are like that, so therefore, why
Very
not?
similar.
Huh?
And we already know there are 16 different viruses and microbes that are, if you are infected with that virus, it increases the risk of a subsequent autoimmune disease. And the coronavirus family is in that group.
Ah,
So many of us are predicting, time will tell, but we're predicting that there will be a higher rate of autoimmune diagnoses if you get the wild type coronavirus. We also think there'll be a higher rate, quite possibly, of Parkinson's, and there may be a higher rate of cognitive decline as well.
Well, that's really, really interesting. I wish there were more. And I'm friends with a lot of the top doctors that are speaking out on television all the time. I'm going to try to shoot a couple of them a note and explain to them that, or have you done a white paper on this and sent this in to anybody?
If you go to the Institute for Functional Medicine, they have a great resource on COVID-19. So ifm.org /COVID-19. We have really wonderful resources on how to reduce the risk of severe disease and to accelerate recovery if you are infected. So I'd send people there. But again, if you're in my practice or if you're following me, we put you down the Wahls Protocol. And that's been very, very helpful.
Well, knowing this information is an important first step, but making changes to your routine, especially ones like eating habits, can, for some people, be quite challenging. And
Oh, goodness, yeah.
Yeah, what tips would you give people, or like to
Well,
share with people how they get started to make those changes in their lifestyle and stick with them?
the first thing I want to acknowledge, Montel, is our biology is such that we do things that are pleasurable. We avoid things that are harmful and that create more pain. We have a lot of attention to immediate pleasure, and it's very hard to forego today's pleasure for tomorrow's benefit. So when you and I tell our tribe and the public, improve your diet, reduce the sugar, reduce processed foods, and move more, we're asking them to create new habits. And if they give up all that sugar and processed foods, they may have some headaches, some malaise, may not feel very good. They're going to have craving. And it's very hard biologically to forego today's pleasure. So what I've learned over time is that I've spent a lot more time on the mental, emotional, spiritual side of things. And I ask people, what do you want your health for? What is it that you care so much about that you would run into a burning building to save without even thinking? And if we can identify those factors and then link their desire to improve their health and identify what is the next step that you would like to work on in terms of what dietary change you want to work on, what self-care routine you want to work on, then we can begin making progress step by step.
I don't mean to ask you this, and I'm not really asking you this for a political reason whatsoever, Dr. Wahls, please. But, I have recently just been completely, almost disheartened and I feel so down when I look at some of the news and I hear some of these comments coming out of these people who are anti-vaccine or anti-truth behind COVID. I was listening to a woman today who literally had a cigarette hanging out of her hand and had the nerve to say that I've been getting all this false information and I don't believe the doctors. I wanted to throw something at the television and say, are you kidding me? But what's so crazy right now in the society that we live in, a society that's about to bear a burden financially, because we all share tax dollars in taking care of those who can't get away from their own shortcomings. I'll say it that way.
Yeah.
The cost of this anti-science, anti-research. How do you convince a person like this who has the nerve to say, I'm not taking no daggone vaccine, but they still will eat a half a tonight? I mean, grilled on an open flame or something. I just, does this not trouble you, especially someone who
Well,
is
it,
that they're
it, it's certainly very, very troubling. We're going to have a large part of society doesn't want to take the vaccine, who will probably, many of them eating a poor diet, have low vitamin D levels, unrecognized insulin resistance, and a high rate of needing hospitalization, ICU care, and prolonged gumming up the hospitals. The consequence to our economy, because we're putting so many more people in the hospital for prolonged care, and so many more people who will be unable to work because of long hauler syndrome. We're going to drive up the cost of healthcare and health insurance for all of us. We're going to drive up the number of folks who can't be gainfully employed. Huge, huge negative consequence. And have we created a system where there are other political actors who are putting this disinformation into our social media to further destabilize our economy and destabilize our country politically? Perhaps.
I mean, I'm starting to think that this is now not just ignorance by choice. This is ignorance with a plan. There are those who, unfortunately, and I hate to say it, but we've lived at a time in the last 5 to 10 years where, so many of these doomsday television programs that we have on, so many of these survivalist programs that we have on, there's a large segment of, or not large, there's a segment of society who thinks that it's going to be okay trying to survive as mankind eating out of garbage cans. And I'm not a big fan of that personally. I'd
Yeah.
like to move forward and see if we can, follow evolution and better ourselves, not make ourselves worse. But I mean, the amount of misinformation makes it hard for me to, when I hear your results from your study, this is plain and simple.
Oh, this is very exciting stuff.
This could impact the entire healthcare system of the world, let alone the United States. If people just decided to follow, the basic things, just, checking their diet a little bit, exercising, getting the right amount of sleep, being mindful, little things that they'd have to do that
are under their control,
yes.
that don't have to cost a lot of money, and that you can implement the Wahls diet on food stamps. And when I was at the VA, we taught people, in fact, how to do that. But it's hard for people to give up their pleasures, their tobacco, their sugar, and we've created a system where now, because of the artificial intelligence in social media, that we have a technology that amplifies more outrageous claims, more sensational. You get more shares on stuff that is a lie. That's just outrageous. And we saw that radicalizing people in the Middle East, in Asia. We saw genocide as a result. And now we're beginning to see radicalization of extreme points of view happening here as well.
Do you think that you feel like the research that you have is published, people can read it, the other doctors can read it? How is this going to impact medical professionals when they treat their patients? I mean, I would think that right now, and I do understand the fact that they're, because of the way medicine is changing in America, some of the revenue streams for doctors are drying up. That's the reason why so many doctors are now signing on to become corporate players in these big, huge entities, making sure that they see 12 patients a day, 5 days a week. I get that. But I think that overall, there would be more money made in well care than healthcare. I mean, we call our healthcare system a healthcare system, whereas really it's a sick care system.
Yeah,
If
absolutely.
we started showing more benefits and direct,
Well,
Yes.
Things are moving. 12 years ago, I was this eccentric oddity. I was being condemned by many folks in the neurology community. I was banned as a speaker by the MS Society. But fast forward, I've done 4 clinical trials. We've got a couple more underway. The results have been consistently positive. I'm funded by the MS Society. And now there are more neurologists that are talking to the patients saying that diet does matter. They are willing to check your vitamin D. And they are willing to say, yes, you should be exercising. It's not universal yet. Yeah, but here at the university, I've gone from being an eccentric to now I'm having conversations with the head of the oncology department, and we're designing a little clinical trial that we'll be doing together using my protocol for cancer patients. And I'm having a similar conversation with the head of rheumatology to test my protocol in Sjogren's patients.
I mean, we're going to have to do this anyway, because I mean, we do know one of the things I think that we as a nation have been avoiding and we don't even talk about is the fact that I think it's this year to next year, this country is going to, and the longer COVID, this pandemic rages, the faster these numbers will be achieved. But we could be by 2024 somewhere close to 500,000 nurses short across America. Why? Just because they're aging out, just because we're not training a new generation.
And they're retiring early.
They're retiring early. And some of them are burnt out, especially because of this COVID thing. And you take a look at the same thing that's going to happen with doctors. We could end up being about 250 to 300,000 doctors short in America. And so,
on the other hand, the Institute for Functional Medicine continues to grow. The American Academy of Anti-Aging Restorative Medicine is continuing to grow. And the public, larger portions of the public are more aware that diet and lifestyle does matter. They're more aware that vitamin D is a good thing, and that walking matters. And we didn't even know to talk about poop, but now people are getting concerned about their microbiome. So we are making some progress.
Well, and I think that's really where we're going to be able to kind of deal with the shortage in doctors and nurses, because if more and more people paid more and more attention to their own individual healthcare footprint, this is something I've been talking about for years. I mean, we worry about the carbon footprint, but we should be worried about our healthcare footprint. If I pay attention to my diet, I exercise, I try to do the things that help keep my healthcare footprint, my personal footprint smaller in its impact on resources being needed by those who really need them, I can actually have an impact on the overall cost of medicine in America. And I think there are more people who are starting to recognize that they can impact their own bottom line by paying closer attention to the gratification of time rather than that overnight gratification that you talked about.
Well, and if you want to have healthy aging, I mean, living to 60, 80, 90, 100, as long as I'm healthy, alert, still playing soccer with my children, grandchildren, what any other kids I have in my life, still playing Pictionary and Scrabble and chess, that sounds pretty great. But if I'm demented and a burden to my family, that sounds pretty terrible.
Right.
The way to have healthy aging is all about diet and lifestyle. It's
healthy living.
Yeah, it's about healthy living. I'll be giving a lecture, actually, which I've been working on, which for the anti-aging folks, which is all about the healing process. We've spent billions, if not trillions of dollars understanding pathogenesis, how disease develops, but we've not spent nearly as much time understanding the chemical processes of how our cells rebuild, and repair. And what can we do to improve that? It's not just stopping the disease process. And of course, what we're learning is that it all, in the end, is going to come down to our healthy lifestyle choices: diet,
Absolutely.
meditation, sleeping, exercise, and supporting the network of healthy health behaviors.
Absolutely. Now you just touched on it just for a second, but talk a little bit more about the ongoing other research projects that you are working on.
Oh, yeah. So we're going to have another study that is going to look at the impact of taking my online course, the Autoimmune Intervention Mastery course. We'll be randomizing folks out of our current disease registry to get access to the course immediately, or to wait 12 weeks and then get access to the course. And we'll be measuring change in dietary intake, diet quality, mood, fatigue, quality of life. And the hypothesis is, by following my online course, we can improve your diet, we can improve your self-care routines, and improve your quality of life. So that's one study. And I'll probably be able to start recruiting for that in the next couple months. The other study that we, again, anticipate being able to start recruiting yet this fall will be a Wahls diet versus a ketogenic diet versus dietary guidelines. And that will be a very exciting study. We'll be following folks for 2 years, so it's a much longer study. And people, they'll have to sign up for my newsletter via my website, because when those studies are finally approved and I can start recruiting, we'll have an announcement up on my website.
That is excellent. That's excellent. I'm just, and maybe this is a rhetorical question, but I just don't know why you are not everywhere. I mean, I want to see you on, every news station across the country, especially right now, especially because of this thing. I mean, I think the word about you needs to get out, Doc. You got a good publicist? What's going on?
Well, yes, I should be getting out more than I am. And why we're having some difficulty, I'm not sure.
Do you think it's pushback from an industry that's so focused on trying to make as much as they can off of people being sick?
I think it's pushback from drugs, yes. I think there's difficulty getting through because of the political environment that we're in, and COVID-19 has sort of crowded sucked a lot of oxygen out of the space. That is certainly a bit frustrating.
Absolutely. And when it comes to, what patients and what individuals need to do, what changes would you like to see, most patients with autoimmune diseases, the way they're treated, what changes would you like to see?
So I want them to improve the quality of your diet. Wherever you're at right now, what can you do to make the diet more nutrient dense? So if you're eating the standard American diet, stop the sugar-sweetened beverages. Eat more vegetables. Replace processed foods, pastas, breads, high glycemic index foods, whipped potatoes, French fries, with vegetables. That'd be a great, great start. If you're into paleo diet, great. A Mediterranean diet is a good step. If you want to do intermittent fasting, now that's a little more advanced. That's also very good.
That's something I stay on. It's not as hard as people seem to think. I try to intermittent fast every single day. I mean, I try to eat my last meal before 6:30. Sometimes, most of the time, I really would rather eat before 6 p.m. in the evening, and I don't consume anything else until I get up in the morning, and then I normally wait 2 hours before I eat anything. So, I may wake up at 7:30, 8. I don't eat my first meal of the day, and sometimes until 10:30 or 11 o'clock. And, I try to make sure I put 12 hours, at least 12 hours minimum, in between the last thing I put in my body and the first thing I put in my body the next day. And that sounds daunting to some, but it's really way easier than you think. Because I can tell you something, if somebody calls me up and says, "Hey, I want to meet you for dinner. Let's meet at 7:30," I said, "I'm sorry, I can't." You know what I mean? I'm not. I'll meet you maybe for a glass of water or a cup of tea, but I'm not meeting you for dinner at 7:30. It's just not happening.
Yeah, and if we, and the other point I want people to understand is whatever intervention you're going to try, actually do the intervention. Do it thoroughly and carefully so you can assess, is this intervention helping? If I'm going to do the Wahls diet, actually do the Wahls diet. But that sounds too hard, but you could just make a point of eliminating sugar in sugar-sweetened beverages. Do whatever intervention you can do and actually do.
And that's right now. I mean, I got to tell you, eliminating sugary beverages. I think maybe even me. I mean, up until for about 5 years straight, when my diagnosis with MS came in, I didn't drink anything. I didn't drink any sodas. I really got rid of soda completely. I drank just sparkling water with ice and lemon. I did that for quite a long time. And then, I don't know, about 4 or 5 years ago, I started because my wife really enjoys, Gatorade. So I started drinking a little bit of that. And then I noticed, I really wasn't feeling that. So I got off it. And now when we travel, I mean, I may go 4 days in a row with just water and lemon, water and lemon. It literally, and I don't even think about it anymore. So I came over and said, "Do you want to have this drink or that drink or that?" No, I just take water and lemon with my meals and dinner. I'm sitting in a restaurant and I see all around me is nothing but soda and wine and this, that, and the other. And I'm sitting there with a large glass of water. But I recognize how much better I feel 3 days later.
Yes, absolutely. Absolutely. And adding soda, all these sports drinks,
I skipped
with all of this high fructose corn syrup, terrible, terrible for you.
Absolutely. Now, where can people go if they want to get more information about the Wahls Protocol? Make sure we go out there.
So Terry Wahls, Terry, Wahls, WAHLS.com.
That's super. Well, I got to tell you, I can't say thank you enough for being a part of Free Thinking with Montel today, Dr. Wahls. I know that this will be consumed and enjoyed as much as your first appearance here. And I just wish you so much. Luck is not the right word. I just hope that you get as much success out of your next trials as you've gotten out of this one. And you always have a home here if you ever have anything you want to share.
But thank you so much.
Absolutely. You have a great day. Stay well, stay healthy, okay? Thanks for joining me on Free Thinking with Montel. Please make sure you're subscribed and hit the bell to be notified when new episodes post each week. We'd love to hear your feedback, so please send us your comments.